Thank you, somebody, for doing that. I keep forgetting to do that. Let's see, slideshow. Slideshow. Okay, so here we are today. Thank you all. Where am I going to put this? Up there. And we have both our presenters are here. So we'll just wait for some more people to come on board. Jolyn, maybe you can give me the let's go signal, and I will we'll move on to the first thing on our agenda, which is, since I can't see the agenda at the moment, I think introductions and our land acknowledgement, right?
Yeah, I think we're good to just kind of go ahead and start, and I'll admit people as they come in.
Okay, should we go ahead? How many people do we have? Let's see.
We've got 11 right now.
11. Okay. Well, welcome 11 people so far. Please introduce yourself in the chat. Although, you know what? 11 people. Let's do a real no, because more people will be coming in. So introduce yourself in the chat, please. Thank you very much. And we'll continue with our agenda. So today we're going to have two amazing speakers. Stacy Burleson is going to tell us about her organization, Women in Leadership. And Chris Gomez is going to bring us up to date on what Western Sky Community Health is doing and how they can help us all make sure that we've got insurance, health insurance. So, but we'd like to start, as always, with our land acknowledgement. And we are trying to make this not become rote. So if you can all just really help me be intent on this as we go through it one more time. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, the Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while strengthening and respecting relationships with Indigenous people. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And as a representative of the newcomers to this land, I want to express my own hope that all of us can work together with respect to continue to protect the land and all the peoples in it. So thank you very much for joining me in that. Whoops, hang on one second. We're going to get out of here and stop sharing and go to our program. So thank you all for joining us again. We're going to have two, as I say, two presenters. And the first up is Stacy Burleson. Sorry, Stacy. Stacy Burleson. I'm not even going to attempt to introduce Stacy because she has an amazing story, but which she will tell you. But I do want to say that she is the founder of the organization Women in Leadership. It's an innovative approach to bringing in women who we might not have thought of initially as being leaders, but she recognizes them as leaders, and she is tapping their talent and pulling them together and addressing some really serious issues in our community. So Stacy, take it away.
Thank you so much, Wendy. Thank you for having me. And thank you, Geraldine, also for thinking about me. So my name is Stacy Burleson. I am the Executive Director of Women in Leadership, which is a program for any woman impacted by the criminal justice system, directly or indirectly. And so I just wrote up a little something that I'll read for you guys. And then if you guys have questions for me, feel free. So Women in Leadership is innovative in that it is founded by two African-American women who have been directly impacted by the criminal justice system for significant amounts of incarceration. And we are both formally trained by Project ECHO, and we are both certified peer support workers. This unique blend of experiences has led us to foster the belief that women are more likely to remain out of custody if they are given the opportunities to develop the skills and tools that empowers them to become leaders, whether that's a leader in the community or a leader within their home. Leadership skills are essential, and that is a part of our mission for Women in Leadership, is developing a pipeline of leaders that collectively feel recognized, equipped, powerful, and capable to be healthy, successful, and meaningful contributors to our families and to our communities. But one of our, specifically, we seek to raise awareness of behavioral health issues in women and youth in the communities, acknowledging historical and current conditions and cultural and community factors that prevent members from accessing and utilizing services. We want to develop a community of understanding of how to overcome these barriers, and we want to connect our clients with treatment. And we want to ensure that evidence-based and culturally responsive treatment and services, are provided. Our services, we provide critical services to three unique populations facing exacerbations of inequities across multiple domains. And that's detained women, women recently released from incarceration, and youth of color who are at risk of or have already experienced a significant amount of violence due to adverse childhood experiences or trauma. So we want to improve behavioral health services in the community by providing meaningful methods to reduce recidivism for women who are returning citizens through peer case management and family peer case management. Our goal is to empower the most marginalized women and youth in our community by providing them with tools, skills, and motivation to be the best version of themselves. We believe that this will help stabilize these individuals and prevent them from crisis. Also, and then I want to tell you a little bit about some of our strengths with Women in Leadership. And one of our biggest strengths is that we are consumer operated. It's by us and for us. It reflects the need of the community and or the interests of the talents of the groups. We incorporate empowerment, responsibility, choice, acceptance, respect for diversity, reciprocity, mutuality in relationships, social action, peer support, and family peer support for those recovering from mental health and or substance use co-occurring disorders. But some of our challenges and some of our weaknesses have been that, there's lockdowns. We could be in the middle of a class or the middle of a training, and the correctional facility could go on lockdown. We are unable to bill Medicaid. So once these ladies are released, we pretty much just work with them on our own, because at this time we are unable to bill Medicaid, or if we don't already have like a contract for the services, then we're not able to do it. And then we need more paid staff for the work that we do, and funding, and, and then also there's a long wait for services for some of these individuals and families, and particularly the detained populations. And another one of our problems has been the pandemic, which in a way it has been good. And then in a way it has affected us. It affected us in a good way because we're able to reach ladies across the whole state of New Mexico versus we may not be able to drive there all the time. And then we're able to Zoom into the Department of Corrections every single day. We do a class with those ladies every single day, but it has limited us from going in person, which we do plan on going soon. And some of the services that we offer, we hold bi-weekly tele-echo sessions. We've been doing this since the pandemic started. It's every first and third Monday of each month. It is focused on mental health, substance use disorder, domestic violence, sexual assault, recidivism reduction, and keeping the family whole. We only allow women in these groups, and we only have female presenters for our first and third Monday tele-echo sessions. So we try to provide education to to our women on how to advocate for themselves and for their families. We try to provide consistent mentorship, warm handoffs, housing stability, education, eviction prevention education, and we want to provide them with educational opportunities that will boost financial stability once they are released. We also do life skill classes and job readiness classes with these ladies. We do something with them every single day. Most of the days, twice a day, we do these types of classes with them. And then we also work with the Black student unions. right now we're in Del Norte High School. We're trying to get to like Highland High School, and then we're trying to get to another high school. And with that, what we want to work on with these kids is we want to focus on gun prevention and guidance, gang prevention, and then substance use and suicide prevention also. So right now with what we're doing with Del Norte High School is we started a podcast with them. And so every Friday we go and see them. We record a podcast. We also provide them with lunch. And then we also provide the Black Student Union with a $200 monthly stipend. So then they could buy the supplies and everything that they need. And you guys could check it out. We have a couple of their recordings on our website. If you go to our website, you'll see podcasts. If you click on it, you'll see the Del Norte High School. And then we also did a podcast also. And then one of the other things that we do with the ladies is that we do one-on-one peer case management on Wednesdays. And so with that is those ladies are getting ready to be released. They're six months to the door. A lot of times they're shorter. And so we get an assessment from the Department of Corrections, and then we do an assessment. Sometimes we have got a psych eval done. We have set up appointments with some of the ladies with the Rape Crisis Center. We're trying to get a young lady in a sex trafficking program in the state of North Carolina. It just depends. And then we just what we really want to do is get with the MCOs, and we have made contact with them, and we want to just connect them with the care coordinator on that part. And so far, so that's what we do with them. We have the first ever contract given to a returning citizen from someone who has recently been released from prison. So that's what we do with them. But one thing that concerns us about the women in prison is that their mental health is really down. There's a lot of ladies inside the Department of Corrections that are on suicide watch. They have what they call one-on-one, where they'll have another inmate watch the other inmate. And so we just recently taught mental health first aid to these ladies. And one thing that they said is that, they're really depressed and they're really sad. I did 6 years in prison. And at one point in time, I was suicidal, but mine stemmed from my son was killed that day. So when these ladies tell me that all these ladies are on suicide watch, it's really concerning to me. And they are telling me that they're sad. And of course, the pandemic affected them just like it affected us. They're short staffed. So a lot of the times they're on lockdown. The ladies that are in Western share, and there's 2 prisons in Western. There's a male facility and then there's a female facility. But when I got out in 2016, we were still at a private facility, and that was CCA. There was only one women's prison. And right after I got out, they split them up. But what happened was these ladies went from going to a private facility, being guarded by guards who guard women, to going to prisons, to a safe state facility, being guarded by guards who have been guarding men for years. So it's very difficult for them. It's really hard for them. And so it's so hard that a lot of them, are on suicide watch. And then the thing about Western is because they're so short staffed that they share staff in between facilities. And then of course, when the men get the staff more than the women do, because the men act up. The men may write 1,000 grievances in 1 year and have a total of 300 write-ups, where the women will have 1,000 write-ups and 300 grievances because women basically, we don't stick together and we don't advocate for ourselves, and then we're just treated differently, and so that's what I got so far. So I don't know if anybody has any questions.
Goodness. Thank you again, Stacy. Every time I hear you talk, I learn something more, and I'm impressed all over again with what you do. Questions? I'm sure there must be questions. Why don't you just, we don't have that many participants. Why don't you just open your mics and ask Stacy your questions, or put them in the chat if you prefer.
And I forgot to tell y'all, one of our projects that we're getting ready to start is that we're gonna do overdose prevention and mental health and youth in the community. Particularly, we want to hit the international district. And so we plan on hitting all the Black churches, all the churches. And overdose prevention's specifically, especially it's in Black men, Native American men, and then I forgot what the other population is. They are overdosing at a higher rate than anybody else. And so, and then most Black people, we don't think that opioids, that's not a Black drug, but it is. And so we have a lot of men overdosing. So we're getting ready to go on a mission of overdose prevention in the community.
Rochelle, could you explain the link that you just posted in chat?
That's a link for Stacy's website.
Okay, thank you.
Oh, okay, great.
Hey, Stacy, it's nice to see you. Thank you for taking the time to share today. I was just curious to hear, like, so I'm sure what you offer, for working with the women in the prison, what type of services already exist there? And because you're already talking about understaffing, and I'm assuming that there's not many programs or services in place already.
Yeah, there's not many services in any of the prisons right now because of the pandemic came. So the women at Springer, they have a couple programs going on over there. I'm not too sure what they are, but I know they have a couple programs going on. Not that many though, maybe 1 or 2. I think we do more with them than anybody, just maybe 1 or 2. But the women at Western, I don't think they have anything because they never have staff. It's like, I don't know if you guys ever heard of Title IX, but we feel like that Title IX is getting, that's the gender equity law. We feel like Title IX is getting used against the women in Grants, New Mexico. I don't know what we could do about it, but they don't really have anything. They're always on lockdown because they're understaffed. You know, so in Western, that's the prison where you go first. And then if you're a lifer, if you got a long time, that's where you're going to be because that's where they have the one man cells. And so, and then if you're always in trouble, then that's where you're going to be. And then if you're suicidal, then that's where you're going to be. And so the level 4s over there are the ones that get in trouble a lot. So, but a lot of these ladies have clear conduct now. And so, but because they're short staffed, they're still locked down. Level 4 is you never leave out, you never go anywhere. So I don't know what they have, honestly, but I know that they are trying. I know they do have some stuff going on. I'm just not too sure exactly what it is.
Stacy, could you take just a minute and put your contact information into the chat? People would like to get a hold of you. And we'll also be providing that in a follow-up communication to all of you.
And we're looking for presenters and we're looking for, speakers. Like I said, we do classes Monday through Friday, Monday, Tuesday, Thursday, Friday, 10:30. We usually start 10:15 to like 11:45 till they call them out twice. And then we go in the evenings from 1:30 to like 2:45. So if anybody would like to ever, come teach a class, I would love for them to come. We could co-facilitate or whatever the case. Like on Tuesdays, we do poetry, and then Dress for Success. They do job readiness classes for us in the evening time. We do a podcast on Monday. So starting in May, the 4th Monday, we will have a podcast which will go live. So you guys will be able to hear the ladies, but you could put your questions in the chat and then you could, add, and then we'll ask the questions. And then we also have like self-esteem classes. So another thing that they lost was they don't have a chaplain. So they haven't had any church services. So we have church services, which will start next month on Wednesday. So we got that for the ladies. That'll start soon. And then, their mail now goes to Florida. It does not go straight to the prison anymore. So they don't get the normal Bible studies and things like they would get. But oh yeah, this is one thing that I would love. So, a lot of times they're on lockdown and they're on restricted movement. And like I said, their mental health is down. So if anybody has like any exercises or any activities on paper that they could do, we could make a packet and we could send it in and to the caseworker, and then the ladies can have something to do when they're on this restricted movement or when they're on lockdown.
Health promotion people. Surely you have these. Stacy, you mentioned that at least in one prison, all the presenters are women. Is that true for all the presentations? Are you looking for women specifically to do these classes?
On our first and third bi-weekly.
Oh, I
television
see.
sessions. But our classes that our first and third, the public and the women, but the classes that we do with the women, only the women join. And so those, it could be a male or a female. We're looking for substance abuse education. We're looking about how to know your body, how to count your period, because there's a lot of young girls in there. Menopause, they want to talk about, a lot of ladies are going to die in there. They're growing old, their body's changing, growing old in prison. They want to talk about that stuff.
Mhm.
Hi, I have a question for Stacy. Hi, Stacy.
Hi.
So we can see each other. Hi. My name is Rose Nelson. I'm the Director of Behavioral Health for Western Sky Community Care. We're one of the MCOs, as you mentioned, and we would love to partner with you. So I see your email in the chat. I'm going to send you an email so we can make sure we connect. And I think there's a lot of opportunity based on some of the things you presented, not only connecting some of the women and even students you're helping with care coordination, but also some of the other opportunities you mentioned. So I'm excited to connect with you.
Thank you. And you have a really good friend of mine works over there, Mark Garden.
He's amazing. He's one of our peer support specialists.
Oh, yeah, tell him I said hi.
I will tell him. Okay, wonderful. I'll send you.
I'll be waiting to hear from you.
Okay, great.
Connections, yes, that's what we live for. Jessica noted that some of the corrections facilities have programs where they allow inmates to earn GEDs as well as even associate's and bachelor's degrees. Are you involved in any of the educational efforts at the prisons?
Yeah. So they do have that. They do have that in the prisons where the ladies can. A lot of ladies are getting their degrees. I mean, they're doing all that. So, but that doesn't. So they're getting that, but they need classes that address the root cause.
Yeah.
And so that's what we're trying to bring. So yeah, they got the GED classes. They're getting associates. They're getting bachelor's degrees. They're getting all that, but they're getting out on drugs. You know what I mean? They're still getting out, going back to their abuser or the person that sexually assaulted them with a degree. And then, you know what I mean?
Not
so
sufficient. Yeah, degree
Yeah,
may
that-
not be
yeah.
sufficient. Mhm.
Yeah. And then another thing is that another things that we want to work on with another thing that we're trying to do is educate the community, like on the language that we use also. So we can't expect for people to come out and be productive members of society when they've been inmates the whole time, and that's what they've been called. You know what I mean? And so some of the things that we want to change is how we address them, because that's how we're going to build up their self-esteem. Because when we reduce recidivism, then we reduce crime, and then we reduce the drugs. And then if we could get some of these ladies, because 85% of them are mothers, and they're getting out and they got all these kids out here. And then also half of these ladies and 95% of them are on drugs. They're getting out addicted to drugs, but half of them didn't go addicted to drugs. They got addicted to drugs in prison.
And Stacy, I know you were saying to Geraldine and I that even though the two Black women founded this organization, you are an organization for all women who are involved in the justice system. And I know that Geraldine's been feeding you some resources. Carrie, I see you're on board too. So those of you that can help Stacy reach out to other populations, I think that might be a good thing. Yes, Stacy?
It is a good thing because even though, African-American women get locked up more than anybody, that's not that many of us. So if you look at the prison, there's 800 women, there's less than 100 Black women. So we ourselves are coming in contact with more Hispanic, Native American, and white women that are getting out than Black women. We haven't interviewed one Black person yet that's getting out because there's not that many of us in there. So it's the other populations that we're coming in contact with. So yes, we have to have case managers of the other race. We have to have presenters of the other nationality. We have to have it because these are the women that we're coming in contact with.
Other questions, comments? Volunteers?
Stacy, I was gonna mention we
Oh.
did have a presenter on here for April's Sexual Assault Awareness Month, and her name is Kenna Chavez. So I'd love to refer you to her and do a connection by email, because she did a really great connection between the Native American culture to body to land, to the organs, things of that sort. So
Oh, yes, we would love to have that. We would love
I
to
would
have-
I would love to come in and talk. Hi, sorry, I'm Athena Huckabee. I'm with Ideal Option. I think I'm actually going to talk after this, but I would love to come in and talk to them about substance use. Sorry, truck going by. Substance use disorders. And then also my MPH is actually in maternal, child, and sexual health. And even though I don't work in that area here in New Mexico, I have a lot of connections. I wonder about having maybe some midwives that, you know, focus on different areas of health. Like you were saying things about like they're counting their cycle and like menopause and, you know, maybe we could get, you know, some midwives, some BIPOC midwives and to talk about that. That would be pretty cool.
Yes, that would be nice. That would be extremely helpful.
So I got your email. I'll put mine in the chat also, and then let's be in touch about that for sure.
Yes, I would be so grateful. I mean, the ladies are hungry. They want it, you know, they want it, they want to learn. They don't want to go back, but they have that drug addiction, and it's just virtually impossible to do it by yourself.
Yeah, it really is. I mean, a community is essential.
Mhm. Thank you so much. I'll be waiting.
Great. Anyone else? Questions?
And another big thing is anxiety. Anxiety is a big thing too.
Say that again, Stacy.
Anxiety.
Mm.
We all have, a lot of us, we all have anxiety. So anxiety is really big. We just had a presentation on anxiety, but any anxiety exercises would help, you know. Mhm.
So Stacy has put her contact information in the chat. Everyone want to take a minute to copy it down? We'll look forward to seeing, let's see, about 15 emails going to Stacy after this session. Stacy, you see that Athena's suggesting Meg Long. I don't know who that is, but Athena's going to connect you to
Okay.
Meg Long, right,
Great.
Athena? Okay, excellent. Stacy, thank you again. The presentation certainly, but all you're doing, the inspiration that you are providing all these women and us. And I hope we can continue to help you build connections, get the word out, get those services to the women who need them, all of us working together to support the work you're doing. Thank you again, and we'll stay in touch. So yes, she is, yes. Okay, great. So we will, all those people that said you're connecting with her, we expect to see that happen. And we'll be back in touch with you soon. And we'll provide this information to everybody in our email list. So you'll be able to get some of the more information about her website, what she's doing, and how to connect with her. So thank you, Stacy.
Oh, check out our website, you guys.
Okay,
Check out our podcast. That's what I meant to say, on the
Yes.
website.
right. Great. Okay, Chris. Western Sky. We've already heard a little bit from Western Sky, from your colleague at Western Sky, but you're going to tell us more about what Western Sky is doing. And I am going to turn over the, I'm going to make you a co-host. I don't know if I need to do that, but now you can share your screen. There you go. Okay.
I think we are good to go. And thank you, Wendy. And thank you guys for allowing me to come and present. Guys, I have a lot of information. I'm going to try to condense to a really short period of time here. The most important thing is I want to make sure you know how to get in touch with me. As I'm going along, I'm really going to be skimming through this presentation for the sake of time. However, I do hope that you'll keep in touch with me if you have questions or would like to learn more about how Western Sky Community Care is here to support New Mexico. Before I get started, I just want to make sure, are you guys seeing the full screen or the presenter view right now of the presentation?
I
think the presenter view.
It's the presenter view? Okay, let's try to fix that really quick here. Okay. Did that fix it or not so much?
see. It's still the presenter view. Yeah.
let me try it. My computer did a little glitch on it the other day, and I've been trying to figure out how to get this thing to fix itself. Let's see here.
This will still work though, if we can't get it into slideshow view.
Cool. Did that fix it?
Yes.
Beautiful. Alrighty, guys. So to get started, let me go ahead and show you our topics for today's agenda. If you'll bear with me just one moment. So today, these are some of the things that we're going to be covering to make sure that everybody knows me. If you haven't met me before, my name is Chris Gomez. I'm a senior community relations coordinator with Western Sky Community Care. We are a managed care organization here in New Mexico. That's MCO for short, and that's Medicaid carrier for layman's terms. So if you haven't heard of us before, do me a favor. If you think of Medicaid, think of Western Sky Community Care. We help provide low to no cost healthcare, and this is based off of somebody. First of all, they have to be a citizen of the United States and they have to be a resident of New Mexico. If they get both those two check boxes marked, we then look into income and family size. And if all that adds up, well, then you can get health insurance. And it's something we're really, really pleased to offer here in New Mexico. I want to talk to you guys a little bit about some of the programs and services we offer. I want to touch briefly on redetermination that's coming up. And I want to make sure that if you guys have questions or would like to learn how to keep in touch with Western Sky and how we can work together to form and create stronger communities, well, I'm your guy for that too. I live in Las Cruces, New Mexico, but I cover all of southern New Mexico. But I do have teammates that will also cover central and northern New Mexico. So one way or another, we got some help across New Mexico. So with that being said, guys, let's jump right into it. Western Sky Community Care is a part of Centene Corporation. As you can see at the little map down here, we are in several states across the United States. Just like the United States as a whole, it's known as the USA, right? But each state has its own individual name. This is very similar to the way that Western Sky, this is very similar to the way Centene conducts business. So as a whole, we're known as Centene Corporation. However, each state will have its own individual name. So here in New Mexico, we're Western Sky Community Care. For instance, Texas, we're Superior Healthcare, so on and so on. Although we are somewhat new to New Mexico, we've been here for 4 years now. Centene has over 30 years of managed care experience to add to its experience. So it's one thing, although we're somewhat new to New Mexico, we bring a lot of experience to the table, and we've been doing really big things since we've entered New Mexico. I want to share some with you guys today. But keep in mind, we do offer 3 different lines of business. So for all things healthcare, please keep in touch. We do our Medicaid program. We also have a program through the marketplace right now known as Ambetter. And we have a Medicare program as well, which is going to be through WellCare. WellCare is the one exception that is not statewide. It is by counties. So there are select counties that our WellCare program is offered. This is one thing I really love about our company, though. It's what makes us who we are, and it's our purpose, our pillars, our approach. Our purpose is to help transform the health of our community one person at a time. Speaking of that one person, we wanted to go into our pillars. This is really what we want to focus on. We want to make sure we're helping individuals on a local level because each area of New Mexico can vary and vary drastically. 2, we want to make sure we're assisting the person's whole health. We don't want to just focus on one concern. We want to make sure we are providing the best possible health outcomes. And one way to really do that is to focus on that individual. So if you put those 3 things together, this is how we are going to provide superior care for our members. And then our purpose is basically going to be Western Sky Community Care exists to improve the health of its beneficiaries through focused, compassionate, and coordinated care. Our core belief is based off that quality healthcare is best delivered locally. That's one thing you'll learn about us. We are very boots on the ground. We want our roots deep within the community, and we want to be making impacts across New Mexico that are going to help all healthcare in a positive manner. So when it does come to Medicaid, guys, there's really 2 types of services you get if you're approved for Medicaid. You have covered benefits and then value-added services. Covered benefits are basically what make us all the same. And it's 5 major categories. You're going to get complete medical care, including behavioral health. We help with vision benefits, dental services. We help with transportation, and we help expecting mommies. So if you qualify for Medicaid, you're going to get those 5 core levels of care. However, although you get the same level of care, where you get the care from can differ. And this is what starts to make us different. So one thing are going to be the networks that each of the MCOs has established. So although you get that same level of care, where you get that care through will determine on how each of the MCOs has established their networks. Now, Western Sky Community Care does have a very robust network that we continuously try to improve, and we're here for our members. So it's one thing we've worked very hard on, and we are pleased to state that we've made some really, really big things happen in the last couple of years. But in addition to that, this brings me to my next slide. These are value-added services. These are special services that you get for being a part of a specific MCO. These are Western Skies. So here in New Mexico, there are 3 choices. You can have Blue Cross Blue Shield, Presbyterian, or Western Sky. If people have Western Sky, and if you're working with our members, I hope you can help share this information with them because it can really help them live a healthier life. The first one I want to cover, guys, is going to be our holistic care grant. This is something that a lot of our members have really, really expressed to us how it's helped them make a difference, but it is a benefit that helps a person in their overall health to their body, mind, spirit, and emotions. So you can use this for a massage, you can use this for acupuncture, you can use it towards food. I mean, the possibilities are really endless, but the benefits are always going to come out huge. So that's something our members can look into, and they can request that simply by being a Western Sky member, contacting our member services. We are also doing baby showers for our members. If you're working with any expecting mommies in the community, please let me know so we can keep you up to date on our upcoming baby showers. We help with baby showers for our members. These are going to be Zoom meetings just like this one. We do hope to go into a hybrid format one day where we're doing in person in Zoom, but at the time it's going to be all virtual. But when a mommy does join, she's first of all going to know that she's going to find out everything she needs to know about Western Sky. We're going to educate her from A to Z on all the different programs, services, and departments that they have access to. But in addition to that, as a thank you for joining, we will also send them an infant car seat or a pack and play, whichever they would prefer, and a baby box full of all kinds of great supplies. One of the newest things we added to that is a form that can help get baby registered in the Imagination Library when they get here, which will help them get up to 60 free books by the time they're 5 years old. We help with electroconvulsive therapy for those members that qualify with the prior authorization. We offer caregiver thank you packages for our members that have caregivers. Our members can request this and give their caregiver a thank you package. We offer our Native American traditional healing benefit. This is very similar to our care grant, but is for our Native American members. We are in the process of incorporating a doula program into our Pacify application. Pacify is a mobile application our members can use that gives them currently 24/7 access to a live nurse, a lactation counselor, and can get you in touch with our member services during their normal hours of operation. Eyeglass repair and replacement. One thing that's really great about us is I mentioned vision is a benefit that you get with Medicaid. However, the prescription's not covered always for adults. With Western Sky, all of our members, including adults, their prescription is covered. Plus, we help with eyeglass repair and replacement. So if you lose, break, or if your prescription changes within a 12-month period, we will assist our members with getting a new set. We help with transportation to a pharmacy and post-discharge meals. If a member is hospitalized upon discharge, we can help them with transportation to get their medications, and we can also help them with home-delivered meals. This is going to also, something new we added is this now goes in handy for new mommies. So again, if you're working with mommies, keep in mind, mommy can work on this benefit and get some meals delivered to her after she gives birth. We have heading home respite beds available in the central Albuquerque area. Home modifications are available to members with a prior authorization. We're starting up a new program known as our food pharmacy. We're working with select farmers markets throughout the state of New Mexico to help our members get access to fresh grown New Mexico food. We offer a tablet and smartphone plan. This is going to be for our members in a nursing facility or assisted living. They have to be in a nursing facility and an assisted living facility. And one I really enjoy is our wellness and emotional support. This is through mystrength.com. It's an application that gives our members assistance with anxiety and depression, among several of its many ways to assist. So they can tailor a plan that they want to learn more about, and then they can log on as often as they want. But it's something a lot of our members have really expressed has helped them as well. Some great departments to keep in mind. If you're working with our members out there, keep in mind we have a lot of different ways to help. But 3 really great departments to keep in mind are the following. First of all, member services. Member services can really help with any general questions or general inquiries. For instance, network questions. In addition to that, like a general inquiry could be like requesting a value-added service. So any general question or general inquiry, member services is a great place to start, and their numbers listed right there at the bottom. Care coordination. Care coordination is a service at no cost to our members. Care coordinators help our members navigate the health field. If you don't work in healthcare, you can pretty much know that it's a little easier said than done sometimes. If you're working in it, you get to know it, you know how to navigate a little bit better. Our care coordinators are there to assist our members that maybe don't have that luxury where they're working in healthcare and knowing the ins and outs on how things work. So they're there to assist them, help them access services, and break down barriers that may be in the way from them getting the best possible care. And of course, behavioral health. Behavioral health is something Western Sky Community Care takes very seriously. If any of our members would like to learn more about what behavioral health options may be available to them, we ask that they reach out to us so we can review those options and see how we can assist. Again, when it comes to our pregnant mommies, we have some really great programs we offer. We have our Smart Start for your baby, our Pacify application, and our community baby showers. I talked to you guys a little bit about these ones already. The one I didn't mention is Smart Start. Once a member is set up with an NOP, that's a notification of pregnancy, they're automatically enrolled in that. They're going to get tons of information on how we can keep them and baby as healthy as possible. And there's great rewards built into that for just doing some of those and those checkups that you do along pregnancy. So this talks a little bit about that about our Smart Start program. For the sake of time, guys, again, I'm going to fly through these ones a little bit here. We do also offer peer support, though. If you are, before I fly on to this next one, if you are working with the expecting mommies, I'm going to put my contact information in the chat. Please follow up with me so I can go into more detail in these programs and how they really make a difference for our members. We do offer peer support through Western Sky as well. We heard a little bit about that earlier, but again, peer support are people who have overcome adversity and now are living healthy lifestyles. This consists of individuals who have overcome behavioral health or substance abuse. So we have several great people on our team here willing to help with that. We do offer caregivers as well for our members that need assistance with the caregiver. That is a possibility we can look into for them. We have an ombudsman at Western Sky. This is a neutral party that really advocates for our members. If they are not getting the care they need and are needing assistance, our ombudsman is a great place to look into. They will advocate for the member and make sure that we are doing all we can to help them with their healthcare needs. Our quality team, when you guys think of quality, just think of quality of life we want our members to have, and that is the best. They work with a lot of preventative measures that we offer to our members and bring to them to ensure that they can live a healthy, happy life. Provider services for any of our members, for anybody on the call who may be working with us and providing care for our members, we truly thank you for that. And we want to let you know we have a dedicated team here to make sure that if you have any questions, that you can reach out to us and we'll be here to assist with that. So we have our provider relations and our provider service team that's here to help. Their number is right down here, and that number is 1-844-738-5019. No matter what language a member speaks, we have ways to help with that. Contacting member services, we can get a translator pretty much in any and all languages that you can think of, and we can also mail that material to our member if they need it. If you guys have questions on switching and enrolling, please keep me in mind. I'm actually a certified PE determiner. If you're interested in learning more about how Medicaid works here in New Mexico, I actually have another presentation I can set up for you or your organization. But if you want to know what documents are required, what are the income limits, all that stuff that goes into getting approved for Medicaid, feel free to reach out to me. I'd love to share that with you and be here as a resource as well. So if you have somebody who needs help putting in a Medicaid application, you can reach out to us. We'll be glad to help with that. But I do also want to state, guys, there's a big thing coming to New Mexico. It's going to affect a lot of our community members. And this is going to be with the public health emergency. With this soon to be coming to an end. When it started, Medicaid was basically put on pause. When you get Medicaid, it's good for 1 full year. After that, you need to recertify for it. But once the pandemic hit, things were put on pause. So a lot of people who have existing Medicaid have not had to recertify for that. That's going to be changing soon. And it's looking like in August, that's going to take place. So if you are working with the general community, let them know it's important to be on the lookout for letters they get in the mail. If they're requesting information, they need to get that into the state or they could lose their healthcare coverage. So just be aware that that's something that's coming up and something we're working hard to make sure that our members know about and how we're here to assist them with the recertification process. Some helpful numbers again, guys. Member services is a great number. If you didn't get it on the first slide, please make sure to write it down on this one. That's 1-844-543-8996. It's a great place to start if you have questions about Western Sky. Again, they can help with general questions or general inquiries. That number also doubles as a 24-hour nurse line for our members. So if they want to call and speak with the live nurse at any point in time, they can certainly do so. Our ombudsman's information is here again. So if anybody would like to contact our ombudsman or share that with our members, our ombudsman is here to help. Our website and our social. If you guys can, do me a favor. If you're on social media, check us out, show us a little love, give us a like, give us a follow. We post a lot of health tips on there. In addition to that, we're doing events all the time. So it's a great way to stay up to date about what's happening in communities near you, so you can keep the community informed on that. Like back to school's coming up soon. We're getting ready for that. And then we also do a few different specialty meetings we have coming up very soon. If you're working with our members, please let them know about it. It's known as a member advisory board meeting. We could really use your guys' help with sharing this information with the community. All of our members are welcome to join the member advisory board meeting here. They get educated on Western Sky, all the different programs and services, pretty much what I did here today, just a little bit more lengthy. But in addition to that, we also want to hear back from them. We want to hear what we're doing good. We want to hear where we can improve. With these bits of information, we can become a better health plan for New Mexico. And that's really the end goal from the meeting, to educate our members and to get feedback on how we can improve and become better for our members. But as a thank you for joining, we do send our members a $25 gift card. We also have a baby shower. Our next baby shower we just did on April 20th, but our next one's going to be coming up in June. So if you are working with any of those expecting mommies, let me know, and I'd love to get you the flyer and the information so you can make sure that all of your Western Sky mommies know about that and they can get signed up to join that awesome opportunity. And again, guys, just if you can, show us that love, give us a like, give us a follow. Our social is something we're really trying to grow. So if you could help with that, we'd really appreciate it. Last but not least, I have some contact information here. I will be putting it in the chat box as well, but my contact information is here. We also have information for our Northern Coordinator, Debbie Silva, our Supervisor, Wendy, and then Sharon Noda White, who works with our Cultural Competency Program, which is another great thing we offer to our members that they can be a part of. These are going to be for anybody working in tribal locations across the state. We do have a tribal relations team. So if you would like their contact information, let me know. I'll switch back to the slide or just reach out to me and I'll get that for you. But that brings me to the end of the presentation. Again, guys, I tried to keep it short and sweet for you today, but I would now like to go ahead and answer any questions if anybody has any at this time.
You got one immediately, Chris.
Okay.
Susie wants to know if someone wants to switch to Western Sky, do they have to wait until open enrollment?
Great question, Susie. And the answer is yes. Well, there's not really an open enrollment with Medicaid. This is something great that our state does. You can apply for Medicaid at any time. Unlike some of the other lines of business, like the Medicare or the Ambetter program, there are select times or you have to have like a life-changing situation to open up a special enrollment period. Medicaid, however, can be applied for year-round. So it really doesn't matter when you need to apply for it. The option is always there. However, when you do apply for Medicaid, the structure works as followed. If you apply and you're approved, you basically will get Medicaid for 1 full year. Once you're approved, you have a trial period. You have 90 days to try out the MCO that you selected, because if you do qualify for Medicaid, you will have to select an MCO, a managed care organization. The exception to that is if you're Native American. If you're Native American, you have a fourth option that's going to be known as fee for service. Nonetheless, though, once you select one of your options, with the exception of Native Americans, because there are some different ways that works for them, but for the general New Mexican population, once they get that approved and select an MCO, they have a 90-day trial period, 3 months, to make sure they selected the right MCO for them, where I really recommend you look into network. You want to make sure you like the value-added services you get. So you're going to kind of make sure that the healthcare is what you're going to need. After that period, you are then locked in, and then you can make a request to switch 60 days prior to your recertification. To keep the math easy here, let's say you got approved in January. You would have till March to switch. If you did not make a change, you will then be locked into that MCO. You can then put in a request to switch in November or December. which will take effect into January. If you do have anybody interested in switching to Western Sky, I can definitely help with that. Reach out to me. I would be glad to follow up with the community member, talk to them, first of all, to make sure that Western Sky is a good fit. My main goal is really just to make sure we take such great care of our members that they want to recommend us to their friends and their family members. So that's the first thing we want to do, is make sure that we're going to be a great fit for them. Once we answer some questions and make sure that we can provide them the care that they need, I can then look them up in our systems and see when they are eligible to switch, and assist them with that process if that's something they'd like to look into. Perfect.
And Chris, I remember you said when we talked, maybe it was last year, you have, you offer, I believe, some how to enroll in Medicaid services, maybe other healthcare services. And you assured me that this was not a marketing pitch in this case, in these cases for Western, but you are open to helping people apply for Medicaid regardless of what they might end up choosing. Is that right?
Yes, correct, Wendy. As a P determiner, I have to be completely non-biased. If somebody asks me who's the best, I cannot say, because that's not ethical. What I can do is give them information and allow them to make a decision that's right for them, and tell them what options are available for them. With that being said, I do have another presentation again that goes into the ins and outs of New Mexico Medicaid. So if you would like to know how that process looks, what are the income guidelines, what different categories of eligibility are there, that's something I can help with. It's a little bit more lengthy, so we didn't go with that one today, but the option is there if you would like to look into it. If you do ever reach out to Western Sky, though, for assistance with getting somebody assistance to process the Medicaid application, we can do so, and we can get them signed up for any of the MCOs. That's no problem. We will get them signed up with whoever they want to choose. We will, however, be here to assist. That's the main thing we're trying to do.
Great, thanks, Chris. And Geraldine, you have your hand up?
Yes, Chris, thank you for taking the time to share today. I have a question, like more in terms of like how you can partner with health councils, or like what options that you have. Like, I know at some point, because I've been reaching out to Western Sky a whole bunch for like doing vaccine events or doing food packages or food bags with our tribal health councils and like certain incentives. So could you talk about that briefly? Maybe if some of our health councils are interested in partnering with you, and what types of services you could offer or assistance?
Certainly can, Geraldine, and thank you for bringing that up. So as I mentioned earlier, one thing about our agency is we're really boots on the ground, and we want our roots deep within the community. And that's one thing we love about working with health councils, is because so many great minds come together for a common cause, and that's just creating healthier communities. So that's one thing we really like to support. So if a health council is needing assistance or wants to work with Western Sky, you know, maybe it's addressing food insecurities, maybe it's addressing vaccine equities, maybe it's addressing any sort of health concerns, that's something we would like to look into and review options on how we can support. Can't make any promises, but what I can tell you is it never hurts to ask. And we love to hear what's going on, because one thing I mentioned earlier in the presentation is we like to help on that local level. And one thing about New Mexico is there's a lot of land, there's not too many cities, so there's a lot of gaps in between places. And there's also a lot of rural areas that need additional support. So coming together with the health councils is a great way to help us learn about what's going on in different areas throughout the state, and what sort of efforts can be done to make the biggest impact. So that's something we're always looking for. So on that note, I'm going to go ahead and grab my, I'm going to go ahead and I've seen it's been put into the chat a few times already, but I'm going to go ahead and put it one more time. I'm going to put my contact information, and if you would like to reach out and learn more about how Western Sky Community Care may be able to work with you to do some real good in the community, we would certainly like to hear from you and explore those options.
Great, thank you, Christopher. That was jam-packed with information. Thank you for sending me the presentation. We will post it so that
Beautiful.
people will have access to it, and they won't have to scribble down all those numbers. They can go back and find the phone numbers and all the rest of the information that you provided. Thank you so much. I expect that Chris is available to individual health councils. Should you like to invite him to come and provide some information to your local community, he'll probably make it local. So any other questions, comments for Christopher?
One more thing I want to put in, and just thank you guys so much for the opportunity to present today. And yes, please if we're not if anybody's attending from a health council and we're not on there, let me know. Again, I do all the southern ones, but I just inherited Southeast New Mexico, so I'm trying to get my roots into that part of the state a little bit deeper. And then I do have 2 coordinators that are working central and northern, so we would really like to get in there as well. So thank you for that, and I appreciate you guys for your time today.
Great, great. Anybody else? Well, thank you again, Chris. That was breathtaking in your in the content and the alacrity with which you went through all those slides. But remember, those slides will be on our website, so you can go back and absorb this information again with Chris, and let him know if you want him to come speak to you again. Okay, well, thank you all. We do want to remind you, let me just share my screen briefly here. We do want to remind you of some upcoming events with health councils. So next Friday, we're going to have a presentation by Cynthia Keloff. I'm not sure I'm pronouncing her name correctly. She has written a paper on how to work with health councils. So health councils, we want you to come on board and give Cynthia some feedback. Has she got it right? Is this how best to work with health councils? And those of you that would like to work with health councils, please join us and we'll have a discussion on how to do that. Our partners in the Department of Health promotion teams are offering some gatherings. Wednesday coming up is the Northeast Region Health Council gathering. That's from 10 to noon. It's going to be virtual. And then on May 6th, the Southeast Region is having their spring Health Council meeting virtual. So everybody is invited. Learn more about what's happening in those regions and learn what the Department of Health promotion teams can do to support your work. Next Monday, we're going to have the next installment of our CDC trainings. This one is on community rebuilding, and it's a continuation of our series for health councils who are involved in the health equity and community rebuilding initiative. But the session is open to anyone who wants to know more about community rebuilding. So thank you all for attending, and we hope to see you next Friday at our next meeting and at our future events. If you have, if you want to get more detail, go to our website at www.nmhealthcouncils.org. I'm going to put that real quickly in the chat. New Mexico Health Councils.org. And we will see you again.
Thank you again, Wendy. Thank you
Thanks
again,
so
Geraldine.
much. Bye. Thank you, Stacy. Thank you, Chris. Thank you, everyone.
Thank you guys, and have a great weekend now. Take care.
You too. Okay.